Hi, I'm Chris Call from EMS1. Today I want to talk to you about patient assessment. After nearly 20 years in the EMS service, I can tell you that what differentiates a good EMT from a great EMT, or even a poor paramedic from an awesome paramedic, is a good, thorough patient assessment. Remembering getting down to your basics is really the foundation of everything else that we build upon to treat our patients. When looking at this, I want to make sure that you understand some of the basic core fundamentals around a good, thorough patient assessment. First of all, we have two types of patients. We have those that are stable and those that are critically ill or injured. On the stable patients, usually our patient assessment is something that we call focused assessment, meaning we might not start from the head and work all the way down to the toes, but instead focus around the area. Maybe it's an ankle fracture. Focus around that area, assess it, treat it, and then do our ongoing assessment after that. But for those critically ill or injured patients, we need to do a head-to-toe assessment, or what we call a rapid assessment, or a trauma assessment, from head to toe to systematically find wherever that patient may be injured. Remember, just because they're bleeding or just because they're screaming, that area of the body may not be the most important or most critically injured part of them. Let's take a look at how to do a good physical exam from head to toe, making sure to systematically walk through every part of the body from top to bottom and assessing for those critical injuries. As we assess a patient, remember, it has to be systematic. Now, what are we looking for? The acronym in the DOT curriculum is DCAP-BTLS. That's deformities, contusions, abrasions, puncture wounds or penetrations, any burns, tenderness, lacerations, or any type of swelling. Now, typically, as you get through this, you are not going to be thinking DCAP-BTLS all the way through, but just remember, those are the type of things. Any abnormality is what you're looking for when you assess a patient from head to toe. Now, for demonstration purposes, we're not going to worry about our ABCs, our primary assessment, our general impression, or even gloves for that matter. What I'm specifically walking through is how to assess the patient physically from the head to the toe. We start up at the head, and as we're assessing, remember, we're looking for any type of deformity. We can even walk through the neck area here, and it's not light of touch. You want to really assess a patient to make sure that you find any type of brain injury, any type of skull fracture, any type of bleeding, that kind of stuff. Look at your gloves, look to see if you see any bleeding. As you walk down, push down on that sternum to make sure that their chest is intact. If they're awake or they can follow commands, have them take a deep breath. Now, this would be a great time to take blood or breath sounds if you haven't already done that in your ABCs or primary assessment. Remember, if you walk down the chest, the next stop is your abdominal cavity. And in this area, there's really 4 quadrants. So we're looking to assess in each quadrant. Up here, and we're pushing, and it's not a soft touch, it's really palmating each of those areas to see if there's any guarding or tenderness, any swelling, or any type of those abdominal injury type findings. When we come into the pelvis, we used to rock quite a bit. But we found that with pelvic instability, we can tell by just pushing down or pushing in if we elicit a pain response or we feel any of that crepitus, we can see that something else is wrong there. Now, when I go to the extremities, I will start with the legs first. I walk down. Now, I walk down one leg at a time. The reason is if I walk down both legs to assess and they say, ouch, you're like, oh, which one? Okay? So start down one side, see if there's any pain, if you're noticing anything, down the other side. Once I get down to the feet, I'll ask them to push down like a feet pedal. I'll ask them to pull back. And really, at that time, I want to do something at the same time to make sure that they're equal strength and range of motion. We'll do the same thing with the arms. We go down one arm, we'll go down the other arm, and then we might check some squeezing of their hands, some distal circulation. At this time, the only thing I haven't assessed yet is the back. We can assess the back when we roll onto a backboard or when we move them from this position. Once again, this part of it is to be systematic and thorough every time so you don't miss any part of the body when assessing. Remember, there's a lot more to this than having a patient that's laying on a ground like this. However, being systematic and concise and assessing your patient the same way every time will allow for you to be proficient and not miss any of those critical injuries.